Hi friends, welcome to Easiness where nursing education made easy. So today we are going to discuss medical surgical nursing 1 from second year GNM. So the first 2 chapters we are going to discuss. So हम लोग आज डिस्कस करेगा फर्स्ट 2 चैप्टर्स ऑफ MSN 1. सो कमिंग टू फर्स्ट चैप्टर, हम लोग फर्स्ट चैप्टर डिस्कस करेगा आज इंट्रोडक्शन चैप्टर में हम लोग थोड़ा इंट्रोडक्शन MSN के बारे में थोड़ा इंट्रोडक्शन जानते हैं. So, evolution of modern medicine and surgery. So, evolution, the history period we will see about the MSN. So, from the time of immemorial, man has been interested in trying to control disease. So, from the beginning itself, the centuries, starting itself, the man has the control in the disease management. The medicine man, the priest, the herbalist and the magicians all undertook the various ways to cure man's disease and to bring relief to sick. So, most of the time they were working the medicine. So they were working, the medicine man, priest and the herbalist were tried to control the diseases from the ancient period of time. So coming to the evolution of modern medicine and surgery, so what is the history behind the medical surgical nursing? So ancient era, at the time of ancient era, early humans used herbal medicines and trepanation. So they have used herbal medicines, the plants, the seeds they used for treatment. So वो लोग पहले क्या यूज कर रहा था, plants यूज करके वो ट्रीटमेंट शुरू किया था. और Egyptians practiced surgery and documented medical knowledge. So basically Egyptians started the process of surgery and medical document and knowledge were started by the Egyptians. Greeks are also known as Hippocrates, and Romans advanced anatomy and disease understanding. So from the Roman period itself, anatomy started. So from the Greek period and the Roman period, the anatomy started. So they have the understanding, they started to have an understanding of anatomy and physiology. So coming to medieval to Renaissance, its Islamic scholars preserved and expanded medical knowledge. So here in this category of 5 to 17th century, Islamic scholars started to preserve the medical knowledge. The Renaissance saw advancement in anatomy and surgery. So at the period of Renaissance, the advancement in surgery has happened. So coming to 18th and 19th century, germ theory. So Louis Pasteur and Robert Koch has given the germ theory. What is germ theory? It's nothing but a microorganism is the cause of a disease. That is what called germ theory. Excuse me. Revolutionized disease understanding. Anesthesia and antiseptic surgeries improved during surgical period. So the 18th and 19th century we have started anesthesia and antiseptic surgeries. Coming to 20th century onwards, antibiotics, Fleming has discovered antibiotics, vaccines, imaging like X-ray, MRI scans, organ transplant and robotic surgery were modernized in the medicine. So nowadays what we have including robotic surgeries. The robots will take care of the surgeries. That kind of facilities in the 20th century, it has advanced. So the medicine field has advanced from the ancient era to 20th century. So coming to concept of illness and disease. So what are the concept of illness? So it is very important. Illness is the inability of an individual to adaptive response to maintain physical and emotional balance. So एक illness हो गया तो क्या हो जाएगा, inability of an individual to adapt or inability of a individual to capable or cope up with the situation. That is what called illness. It is the inability of an individual's adaptive response to maintain physical and emotional balance. So disease, what is the definition of disease here? So disease is any disturbance or anomaly in normal functioning of body that probably has a specific cause and identifiable symptoms. So it is nothing but it's an disturbance in the normal functioning of our body and it will show specific causes and identifiable symptoms. So that is what called disease. Coming to, there are two major types of illness, that is acute illness and chronic illness. So these are the main types of illness, acute illness and as well as chronic illness. So what is acute illness? It is sudden onset. The symptoms will last for a short duration. So symptoms will be suddenly appear, but it will last for a few days, like 5 days or 6 days or 1 week. More than that, it won't appear. So often resolving with or without treatment, like example flu, fever, appendicitis. So it's a sudden onset of the symptoms, but it is for short period of time. Coming to chronic illness, a long-term condition that persists for months or years, often requiring ongoing management. So this is a chronic condition where these patients need to have a treatment for a particular period of time. So they need to continue years or months. First one is germ theory. So first is germ theory, that states microorganism, bacteria, virus, fungi are the cause of many diseases. So according to germ theory, they are suggesting that the disease is caused by microorganism. That is what called germ theory. It was developed by scientists like Louis Pasteur and Robert Koch. So in the ancient period of time, Louis Pasteur and Robert Koch has discovered germ theory. Nothing but the microorganism is causing diseases to human beings. Revolutionizing medicine by leading hygiene practice, vaccinations and antibiotics. So they started to give the antibiotics, hygiene practices like pasteurization of milk is by Louis Pasteur, and vaccinations, introduction of vaccines were happened by the past time of Louis Pasteur and Robert Koch. So germ theory exists. Germ theory is based on the diseases is based on microorganisms. That is what called germ theory is suggesting. Coming to the next theory, that is web of causation. So the web of causation is a model used to explain complex and interconnected factors to contribute to development of disease. So web of causation has so many webs. It is like interconnected factors, like more than one factor is the cause of a disease. So it is interconnected. It emphasizes that diseases are not caused by single factor but rather by network of biological, social, environmental and behavioral factors. So not only biological factors, it is also affecting the psychological, mental, social and ability of an individual. So it's a web of causation. It's a group of diseases or group of symptoms that is causing the disease. That is what called web of causation. It's a second theory of disease. Coming to the third theory, that is multifactorial causation theory. So it suggests that results from combination of multiple factors. So multifactorial means combination of multiple factors, like example genetic factors, environmental factors. So that factors togetherly it will cause a disease, then it is multifactorial theory. Suggests that diseases result from combination of multiple factors including genetic, environmental and lifestyle influences interacting in the increase of disease risk. So some diseases it will affect both the persons, both the physically as well as genetic, environmental factors also will be there as a reason for the disease. So this is the next theory, that is multifactorial causation theory. Coming to the fourth theory, that is epidemiological triad. It's a model used to study disease causation consisting of three components. So it's a consisting of three components. One is agent, second is environment, third factor is host. So what is agent? Agent is the microorganism or factor, like example bacteria, virus, toxin that causing disease. So the person or the thing that is causing the disease, that is what called agent. Here it is microorganism. So microorganism or the factor that is causing the disease, so by which it is diseases is occurring, that is what called agent. So host, who is the host? The organism, human or animal that can be infected, influenced by the factors like immunity and genetics. Mainly the host will be a human being or animal who is infected with the microorganism, the agent is entering into the body and it will create the infection, then it is host. Coming to environment, external conditions like climate, sanitation, population density that affect the disease transmission. So that is the environmental factor. So some external climate, so the surrounding of that individual also influence the disease process. So that is what called epidemiological triad is stating: agent, host and environmental factors. So disease occurs when there is an interaction between these three factors. So any interaction between the agent, host and environment, then it is called as disease occurring. So that is what called epidemiological triad. So coming to causes of disease. So what are the main causes of disease? First is infectious agents like bacteria, virus, fungi and parasites. So the microorganism is the main cause, infectious agent. Coming to genetic factors, inherited mutations or genetic predisposition. So from the family history, from the genetics itself, that person is getting any diseases or from inherited mutations. Environmental factors like pollution, toxins, climate and living conditions like extreme climates, extreme hot climate, it will cause diseases. Extreme cold climate, that also will lead to diseases. So lifestyle factors like diet, physical activity, smoking and alcohol use. So that sedentary lifestyle, physical inactivity of a person, diet, nowadays the people will have they don't have a balanced diet, that also smoking and alcohol use. So these are the factors that is contributing to disease. Social determinants like access to healthcare, socioeconomic status and education. So the basic education, if they don't know, they will not go for the treatment. So socioeconomic status, if they are from a poor family or a middle income family, so the treatment and all, they can't be affordable. And access to healthcare, so they don't, if they are living in a rural area, they don't have the access for a better health care. Psychological factors like stress, mental health and behavior. So these are the main causes of diseases in human beings. Yes. So coming to nursing process, another important topic or another important question that may come from the unit 1 is nursing process. So nursing process is an organized, systematic and deliberate approach of nursing with the aim of improving standards in nursing care. So what all the care as a nurse we are giving, that should be according to the standards and protocols. Then it is what known as nursing process. The term nursing process was introduced by Hall in 1955. So what are the nursing process? Assessment, diagnosis, planning, implementation and evaluation. So assessing the problem of the client, assessing the problem of your patient, and then we are making the diagnosis. So from the problem we will make the diagnosis of the patient, and after that we will plan the care, planning the care and implementing that care, implementing that plan and evaluation, what result we got, that is what called evaluation. So first one is nursing process, it is assessment, gathering information about patient health status including physical, emotional and social aspects. So both type of data we will collect. What are the data? Subjective data, what the patient is telling you, and the objective data, what you are observing as a nurse. So that is the assessment, gathering information about the patient. So coming to the second process, that is diagnosis, identifying the patient's health problem based on the assessment data. So from the data what we are collected, we are getting the result. We are taking the nursing diagnosis. We are identifying the patient's health problem from the data we are collected. Coming to planning, developing a care plan with goals and intervention to address the patient need. So according to the patient's situation or condition, we will make the plan to give the care. That is what called planning. So just planning what to need to give the care, what care we need to give to the patient. So coming to fourth one, implementation, carrying out the intervention outlined in the care plan. So what we have planned in the planning process, that we will implement here in this fourth stage. So planning, implementation. Evaluation, assessing the effectiveness of interventions and making necessary adjustments to care plan. So what is the result, end result, feedback, how well it is helped the patient to recover, or anything we need to change, we will take the evaluation. So nursing process, it's a continuous process, it's a cycle. So if evaluation we are getting that the patient didn't get any benefits from the plan we had, so we will again plan for the patient. So it's a process where it is a cycle, it will continue every time. So assessment, diagnosis, planning, implementation and evaluation is the nursing process. Coming to nursing care plan. So what is nursing care plan? Everyone will be writing nursing care plan. So what is nursing care plan? So nursing care plan is outline the nursing care provided to an individual. So what care we are giving to one individual, that we are depositing, that we are outlined through a nursing care plan. That is what called nursing care plan. So it's nothing but a nursing care plan outlines the nursing care to be provided to an individual, family and community. So it's a set of actions by the nurse will implement to resolve or support nursing diagnosis by nursing assessment. So from nursing assessment, nursing diagnosis, planning, implementation and evaluation. So that's the total nursing process you are giving. So that you are outlining in a nursing care plan. So that is what called nursing care plan. What are the characteristics of nursing care plan? It focuses on holistic and is based on the clinical judgment by of a nurse using assessment data collected from nursing framework. So what data you collected as a nurse, you are using it to identify the process. So clinical judgment you will make based on the data you have collected. So it is focusing on holistic, not only biological needs or physical needs of an individual, it focuses on the social needs, individual needs and spiritual needs. That is why called holistic. It focuses on client specific nursing outcomes that are realistic for the care plan. So based on the realistic situation, we need to plan the care plan. So it focuses on the realistic situation, the present illness and disease of the individual. It relates to the future. So it need to be related to the future. Why? Because again that disease may occur. So the planning we are doing, it should be favorable. It should favorable for the future use. And it's a product of deliberate systematic process. So it should follow the systematic from assessment to evaluation. So that is a nursing care plan. Yes, so till now we had discussed about unit 1, the important things that are theories of disease, what is disease and illness, that is you need to study, and theories of illness along organization, validation, documentation of data, collecting the data from subjective data to objective data. Subjective data, what your patient is explaining, and objective data, what as a nurse you are observing. So health assessment is a systematic and continuous collection, organization, validation and documentation of data. That is what called assessment. It is a systematic and dynamic process by which the nurse, through interaction with the client, significant others and healthcare providers, collect and analyzes data about client. So according to American Nursing Association, ANA, what it is, the definition is, it is a systematic. So it is following the systematic and dynamic process by which the nurse, through interaction with the client. So the nurse will interact with the client or significant other people like the family members and the healthcare providers and collect and analyze the data needed. That is what called health assessment or nursing assessment. Coming to purpose of assessment. Why we need assessment? What is the purpose of assessment? To collect the data about physical, mental and social well-being. So the persons, we are collecting the data to collect the data about physical, mental and social well-being of an individual. To contribute to medical research. So it also helps to contribute to the future medical research and to determine the client's risk for dysfunction or to identify life-threatening problem. So from the data collection, we need to get the client's dysfunction. So what the disease the client have and what are the life-threatening problems they are facing. So that we will get by the data collection. To provide data for diagnosis. So from the assessment only we can make the diagnosis. So assessment is the basic step. So to provide data for diagnosis. To compare the client's current status to baseline data previously obtained. So at the end of evaluation, what all the data we have collected, we can compare that data with the evaluation result. So that is what we are using assessment. So these are the main purposes of assessment. Coming to types of assessment. So first one is initial or comprehensive assessment. A thorough evaluation conducted at the start of care to establish a health baseline and identify potential issues. So it from the patient coming to the hospital itself, first we are doing, that is first assessment what we are doing, that is what called initial or comprehensive assessment. So it's a thorough evaluation conducted at the start of care. So when the patient got admitted to the ward, first what we are doing is initial assessment. Coming to problem focused assessment. So the second one is problem focused assessment. A focused evaluation addressing a specific health problem or concern. So here we address the specific health problem of a particular person. So we are not giving an initial or comprehensive assessment. We are just focusing on the particular process, particular disease of that individual. That is what called problem focused assessment. Time lapsed assessment, a follow up assessment to monitor changes or progress over time. So time lapse means after the discharge, patient is going home, after some few period of time he will come back for the follow up. That time we will do the assessment. So monitoring monthly or yearly basis. So we are collecting a follow up assessment. That is what called time lapsed assessment. So the third month, what are the symptoms he had, it should be, it won't be there in the 6th month. So the improvement in the patient condition we will see through time lapsed assessment. Emergency assessment, a rapid assessment performed in urgent situations to identify and address immediate life threatening issues. In the emergency situations we are doing this. So in the emergency or life threatening symptoms that the patient is having, then we will do the emergency assessment. The data collection will be emergency. So these are the main types of assessments. It include initial or comprehensive assessment, problem focused assessment, time lapsed assessment, and also emergency assessment. Yes, I hope everyone understood. So coming to another important thing, that is health history. It is a collection of subjective data regarding client's health in chronological order. So we are getting a health history is a subjective data. Subject is here our patient. So patient is our subject who is giving the data. We are collecting the data directly from the patient. That is what called, it's a collection. That is what called health history. What are the components of health history? Biographical data. So what are the biographical data? Name, age, gender, educational qualification of an individual, occupation, marital status. So that all the things coming under biographical data. So age, name of the patient, age of the patient, gender, occupation, marital status, that kind of things is coming under biographical data. Coming to chief complaints, example that patient is suffering with stomach pain. So that is stomach pain, he will complain as a chief pain, chief symptom. So what are the chief complaints he is having? Or a breathing difficulty, if he is having a breathing difficulty, that is what called chief complaints, what the patient is saying. Present and past medical history. So what are the present medical history he have? Presently any medicines he is taking, or past medical history. So any diseases he is already having, he is taking any medicines for that. That we will collect in the present and past medical history. Coming to present and past surgical history. So any surgeries done before or any surgeries done now. So surgery data. So we will collect any surgeries the patient has done before and any surgery the presently he had done. And family history. So family history include the family name, that family details we will collect. Family's name, age, relation with the patient. So that all things we will collect in the family history. Socioeconomic history. So how the patient is living, what are the conditions he is living, that is we will collect in socioeconomic history. Obstetrical history for female clients, like menstruation period and any pregnancy or any abortion or any delivery related, we will ask in the female clients. And mental health history, how well the patient conscious orientation, we will check in the mental history. So these are the main ways we will collect the components of history. So health history is very important. So we will collect the data about biographical data, chief complaints, present and past medical history, present and past surgical history, family history, socioeconomic status, obstetric history for female client, and a mental health history. Next one here we are going to discuss about physical examination. So physical examination is defined as a head to foot assessment. It's from head to foot. We are doing the assessment to evaluate body and its function using inspection, palpation, percussion and auscultation. So we are using mainly 4 techniques here, that is inspection, palpation, percussion and auscultation. So it's a physical examination of head to toe assessment. So techniques and methods of physical examination. First one is inspection. So what is inspection? Visually examine the patient's body for signs of abnormalities such as changes in skin color, shape and movement. So with our eyes we are visualizing, we are seeing, we are observing the patient for identifying any skin change color, any skin color change, shape or movement. So it is visualizing, examining the patient body. So with our own eyes we are inspecting, we are observing the patients. So coming to second one is palpation. Using hands to feel abnormalities, tenderness and organ size and texture. So we will use our hands to palpate the body to identify the organ structure and texture. So that is what called palpation. Next one is percussion. So tapping on the body to assess the underlying structures of sound that indicate normal or abnormal sound. So tapping, we are using our fingers to tap the body to identify the sounds, any abnormal sound is present. Auscultation, listening to internal body sounds such as heartbeats, lung sounds or bowel movement using a stethoscope. If we are using a stethoscope to auscultate, means we are listening to the sounds like heart sounds, bowel movements and lung sounds. Mainly we are focusing through auscultation. Auscultation we are using stethoscope. Next one is olfaction. Using the sense of smell to detect unusual odors that may indicate health condition. Example, fruity breath in diabetes. So the patients with diabetes, they'll have fruity breath. So using the smell, olfaction, we are using the smell to identify the disease conditions or problems of individuals. So this is the physical examination techniques. So coming to general clinical investigation. So what are the investigations we will do in generally? It is physical examination. A thorough assessment of body systems using technique like inspection, palpation, percussion and auscultation. So physically we are examining head to toe assessment we will do. So that is what called general clinical investigation. First is physical examination. Next is laboratory test. So from the lab itself we will do the test like blood test, urine test and other samples analyzed like abnormalities, CBC, liver function test. So we can do the blood test like CSF, CBC, blood test, urine test, that kind of test. Coming to imaging, techniques like X-ray, CT scans, MRI scans and ultrasounds to visualize internal structures. To visualize internal body organs, we will use imaging techniques like X-ray, CT, MRI, ultrasound, this kind of test. Electrodiagnostic tests like ECG, electrocardiogram, EEG, electroencephalogram and EMG to assess the heart, brain and muscle function. So ECG and all we will use electrodiagnostic test. Also screening tests like routine checks for condition like diabetes, hypertension or cancer based on the risk factors. So these are the main general clinical investigations we are doing to identify a disease condition or to support the diagnosis and treatment. So that is why we need general investigations. So we have discussed about 2 chapters. I hope everyone understood. Yes, first two chapters of medical surgical 1 we have discussed. So the first chapter we need to concentrate on illness, disease and the types of illness along with nursing process and nursing care plan. And in the second chapter we need to study about health assessment, history collection, physical examination and the general disease conditions. So till now we had discussed about MSN Unit 1 and 2. So I hope everyone understood. So we will meet in the next sections with another chapters. Till that, thank you.